Could the story of your heart be written in your genes? I'm Dr. Shruti Bajaj, your genetic expert at the Purple Gene Clinic, and today I'm going to try and understand what is the link between genetics and a child who's born with a heart defect, hole in the heart, or call it congenital heart disease. Firstly, let's try and understand when should one suspect that a congenital heart disease could be due to a genetic disorder. Well, look for certain clues. Does the child have additional birth defects? For example, cleft lip, cleft palate, some facial differences, abnormally placed internal organs, an additional finger, to name a few. Secondly, is there a family history of a similar heart defect or some other genetic syndrome? Thirdly, does the child have unexplained neurodevelopmental delays or some unexplained medical complications? These could be pointers towards an underlying genetic disease. Let's talk about numbers. It is said in literature that 30 to 40% of congenital heart diseases could be due to underlying genetic diseases. These include chromosomal conditions like Down syndrome and certain single gene disorders called as rasopathies. When a child is born with a defect in the heart, it's natural that the focus would be on the heart. But in some cases, there could be additional medical problems lurking around. For example, in DiGeorge Syndrome, there could be additional low calcium values which can trigger convulsions, a cleft palate which may require additional surgeries, and a defective immune system which can make infections dangerous. Being aware of these complications can alert the medical team and help them prevent them in time, thus improving the child's quality of life. Confirmed genetic diagnosis also helps in personalized care. Did you know DiGeorge syndrome is also associated with certain spinal abnormalities which are important to note in the pre-surgical and the surgical period because how we position the child matters. And finally, a confirmed diagnosis brings clarity for the family. For parents who wish to plan another pregnancy, it gives them an idea about the risk of recurrence and helps them to take informed choices. So you see, it's not just about naming a condition. It's about supporting the child, guiding the medical team, and empowering the families together to build a healthier future. Thank you so much.